If you've been comparing compounded semaglutide to Ozempic and wondering if they're actually the same thing, I want to give you a real answer, not a sales pitch, a clinical one. The active ingredient is identical. Both contain semaglutide, the same GLP-1 receptor agonist that signals your brain to reduce appetite and slows gastric emptying. The molecule itself is not in dispute. That part is settled science. Where they differ is in three areas, and I want to be transparent about all of them. First, manufacturing. Ozempic is produced under FDA, current good manufacturing practice. Compounded semaglutide is prepared by state-licensed 503B pharmacies. That's a different regulatory pathway, and it matters. Second, clinical trial data. The SUSTAIN and STEP trials studied the brand formulations specifically. Compounded versions have not gone through equivalent independent trials. Third, the excipients, the inactive ingredients, may differ depending on the pharmacy. That's worth asking about. So why do we offer compounded semaglutide at Text2MD? Two reasons. Access. Many patients who would genuinely benefit from this therapy simply cannot get there through brand pricing or insurance. That's a clinical problem, not just a financial one. And personalized dosing. Brand name Ozempic comes in fixed increments. For patients who don't tolerate those jumps well, and many don't, compounded formulations allow us to titrate more gradually, more precisely, to what your body actually needs. That flexibility has real clinical value. We source GLP-1s exclusively from 503B licensed pharmacies and review their quality documentation before we begin. This isn't a subscription box. There's physician oversight, lab monitoring available, and dose adjustments throughout your program. If brand name Ozempic becomes accessible to you, we'll talk about it. Our goal isn't to sell you a particular product. Our goal is your best clinical outcome, and we want you to understand exactly what you're taking and why. If you have questions, text us 973-847-2280. A physician responds. Not a bot, not a form. Text us your questions.